Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. And a great question came in yesterday. Sometimes I get, consumers that ask questions. Sometimes I get doctors that ask questions. Ultimately, for most consumers, I refer them to go to their orthodontist or their dentist to ask questions. But someone did ask, is IPR painful? And I just realized I really never covered that. There's no reason IPR should be painful. I do have a lot of other IPR videos. Most of them are directed towards either very high level, like what is IPR, or they're directed towards dentists who are looking to find different ways of doing IPR, but we've never really addressed the IPR pain thing. So let's just talk about that on a high level. But you definitely want to dig more into all my IPR videos, as well as I'm doing an IPR webinar. If you are a dentist this fall, it's in November. You can go to my website, Straightsmile Solutions, look under classes, and it is free, and you get CE units. So if you're listening to this and you want to learn more about IPR and get credits for it for free, please sign up. Deadline's coming soon. All right. So why would IPR even be painful? And as far as, the way it feels, and I've had it done, is kind of like taking a nail file and filing your nails. The enamel of the teeth does not have nerves. The only thing that has nerves is if you went too deep into the next layer of the tooth, which is the dentin, or you got close to that, or if you were too close to the gums. So you have to stage and pick your IPR well. You can't just do IPR because you think you have to do IPR. You have to say, well, is it appropriate for this tooth? I'm looking at the x-ray. Can I do it on this tooth? Just because the computer says I can doesn't mean I should, right? And even take a step back, because I have a really good video that you definitely want to check out. I think it's like, it's about, I know if you put in the search term crowding or 5 ways to fix crowding, or something like that, it talks about the 5 different ways to fix crowding. You've got expansion, you've got proclination, you've got interproximal reduction or IPR, you've got sequential distalization, and you've got lower incisor extraction or extractions in general. Those are the 5 ways. So anytime you especially have a braces case or an aligner's case, you have to say, if you have crowding, well, how do I want to fix this? I don't just fix this the way the computer says I should fix this. I need to fix this the right way for this patient. And if you're considering IPR, first thing I'm thinking is the patient's age, how big the pulpal chambers are, how much enamel we have. A younger patient, I'm probably not going to do it. I'm probably going to do it on 30 and up, 40 and up. The older the patient is, the more likely I'm going to do IPR, because it's going to be a much more asymptomatic. The gums will have shrunken down a little bit. The nerves will have shrunken in a little bit. We're going to have a good enamel to dentin ratio, and it shouldn't be a problem. So that's kind of when I do IPR. I don't do them on young people. It would be very minimal, like, and only upon request, maybe for a black triangle. That's just the way I do things, because there's always other ways to move around bites and fix crowding that are better. IPR shouldn't be painful as long as it's diagnosed and treatment planned properly, is what I'm getting at. So if your doctor's telling you you're having IPR, you should first of all ask a couple different questions. Number 1, where? How many sites? So where? 1 site, 5 sites, exactly where, this tooth, in between these teeth. You want to ask for the IPR map so you know which teeth are getting it and why. Why am I getting IPR? And what was it not possible to fix this bite or this crowding another way? What were my other options? I would be asking that, definitely. And then if they told you, there'd be a couple acceptable reasons. To me, black triangles are not necessarily a problem. They're not a bad thing. If you're complaining about black triangles, well, then you get IPR. That's the only options, either that or veneer. So, but if they're saying that there's a Bolton discrepancy, look up my video on Bolton to understand that. Okay, a mandibular Bolton discrepancy, and you didn't want to get restorations on your top teeth and pay for those, okay, then IPR is indicated. There really is no other way, I agree. But you can also ask how much per site. In a younger patient, I don't like to do more than 0.2 millimeters, maybe 0.3 if I'm pushing it, if they're under age 25. That's just my personal preference. I like to take as little enamel off as possible and maybe do it in more sites. So you can ask, is it possible to do less IPR per site and distribute it over more sites? Now, a lot of doctors are lazy and they would rather just go aggressive on one tooth than spend time on multiple teeth doing less and having to be much more gentle. But that you have a right to ask for that. So I'm going to give you some tips. All right, so once you've kind of established the why and you found out you really actually need it, then And if they're saying it's just for crowding, well, guess what? You don't need that, especially if you have your wisdom teeth out. Have your wisdom teeth in, you know, and we've taken a step x-ray and we can't move your teeth forward, or maybe you have some periodontal disease, we can't move your teeth out, well, then that's what you get, because you're putting us up against the wall and there's limitations on how we're going to move the teeth. So next question you want to ask is how are you planning to do it? There's three main ways. There's burrs, like mosquito burrs, discs, and strips. And there's strips that are just strips or strips on a dial. I would specifically ask which burrs, discs, strips. Now I have a ton of other IPR videos where I go over the risks and benefits of burrs, discs, and strips. Definitely watch those videos. What do I personally use in my office? And it's been a little while since I've had to do it, but I play it safe. I use the Fit Strip by Garrison. That's the one I lecture for. No, I do not get a commission on their sales. I'm lecturing because I actually think it's a good product, and I was using it, and then I contacted them and I said, hey, this is a really good product. By the way, I use it. I'd love to lecture for you. So it has a little dial so you can pre-curve, so you can do it at the beginning of the treatment plan when the teeth are still crooked, or the end when they're straight. It's not going to nick the gums or anything like that. It's very gentle. Yes, it's a little more time consuming than this, but you're not going to get ledging or any of that other stuff. You got to be really careful with these suckers, with these discs. Be very careful. All kind of weird stuff can happen. There's a few kind of patients I'd use discs. Check out my other videos on IPR where I go over that. All right, so you can always ask your patient if it is going to be subgingival in terms of the position. You know, it's just where your contact of your teeth is. If your teeth are contacting under the gum line, when you floss, if you take your floss down below the gum line and it's still touching, well, then it's probably going to hurt. So again, this is a question sometimes you can ask to get dumbed up for that procedure. I also don't really love the idea of doing IPR if it's going below the gum line, because it could damage your gums. So all right, great questions to ask your dentist. Thank you.